A very good morning. This is me, Nafisa. Studies have shown that breastfeeding is best for the baby and breastfeeding is also best for the mummy. Breastfeeding provides health benefits for the mummy too. The more months the mom breastfeeds, the greater the benefits for baby and mom. Most importantly, the effects of breastfeeding are lifelong, not just while she is breastfeeding. Advantages of breastfeeding to the mom are very many. When the baby is breastfed, skin to skin contact, which is recommended immediately after birth, or physical contact between the mother and the baby, or the act of suckling by the baby, helps both mother and the baby's brain to release oxytocin. Oxytocin is known as a hormone of love. This offers strong sense of love, closeness, attachment, comfort, gives calm feeling, increases affection, helps in emotional bonding and promotes better sleep in both baby and mom. Maternal stress will lead to inflammation, which may lead to anxiety, high BP and depression. During breastfeeding, oxytocin is released. Oxytocin is also known as the anti-stress hormone. That means oxytocin reduces stress, which makes the mother feel more relaxed, lowers anxiety, lowers BP, and has antidepressant properties. We said stress also leads to depression. Depression that happens in some women after having a baby is called as postpartum depression. Postpartum depression may occur from the first month to 12 months post delivery. Breastfeeding may protect the mother as oxytocin lowers the risk of postpartum depression. Oxytocin helps in quicker and easier recovery from childbirth. How? Maternal stress during labor and delivery will lead to inflammation. Stress leads to inflammation, that is tissue damage. One of the symptoms of inflammation is pain. Oxytocin released during breastfeeding will lower stress and hence reduces inflammation, therefore promotes healing. Moreover, oxytocin has been shown to decrease sensitivity to pain. Therefore, breastfeeding plays an important part in mother's quicker recovery after childbirth. During pregnancy, placenta attaches to the wall of the uterus. Placenta provides oxygen and nutrients to the growing baby and removes the waste products from the baby's blood via the umbilical cord. Once the baby is delivered, uterus continues to contract to deliver the placenta. This is called as the third stage of labor. After the placenta is delivered or pushed out of the mother's body, these contractions will continue and help to compress the blood vessels where the placenta was attached to the mother's uterine wall. If the uterus does not contract strongly, then the blood vessels are not compressed. This results in continuous bleeding and hemorrhage occurs. Hemorrhage means blood loss inside the body. Because this excessive blood loss happens within the first 24 hours after delivery or may happen 24 hours to 12 weeks after delivery, hence referred to as postpartum bleeding or postpartum hemorrhage or PPH. Oxytocin causes muscle contractions of the mother's uterus, hence will help in childbirth, placenta delivery, and will compress the blood vessels, therefore reduces blood flow. Can I say oxytocin reduces the risk of postpartum hemorrhage and anemia after delivery? The benefits of breastfeeding for the mom include faster weight loss after childbirth. How? Normal size of the uterus is the size of a closed fist. During pregnancy, the size of the uterus expands to accommodate the growing fetus. Oxytocin also causes the mother's uterus to contract faster and shrink back to its pre-pregnancy size and helps the mum to lose weight quickly. Mother's body uses energy to make milk. Breast milk production requires approximately 300 to 500 calories per day. Hence, breastfeeding for 6 months may help a woman lose the weight gained during pregnancy and help her return to her pre-pregnancy weight quickly when combined with proper diet and moderate exercises. Oxytocin causes muscle contractions of myoepithelial cells. That means oxytocin causes muscles surrounding the alveoli to contract and hence helps in milk secretion from the alveoli. That is, stimulates the let down reflex, hence helpful for the baby to get milk. Breastfeeding for beyond 1 year has long-term health benefits for the mother, as lowers the risk of heart diseases, type 2 diabetes, hypertension, and hyperlipidemia. Let's understand how. Maternal stress during labor and delivery will lead to inflammation, which may result in increased risk of heart diseases, type 2 diabetes, hypertension, and hyperlipidemia. Breastfeeding releases oxytocin, which reduces stress and hence lowers inflammation and therefore decreases the risk of heart diseases, diabetes, hypertension, and hyperlipidemia. Breastfeeding makes the cells more sensitive to insulin hormone, therefore decreases the risk of diabetes. During pregnancy, excess abdominal fat is accumulated, which is an important risk factor for developing diabetes. Breastfeeding helps in breakdown of fats and sugars and hence reduces bad abdominal fat and increases healthy fat on the thighs and hips. Therefore, reduces the risk of developing diabetes later on in life. Breastfeeding beyond 1 year will ensure that the mother has stronger bones later on in life. Research shows that breastfeeding women are less likely to develop osteoporosis. How? As we all know, babies need a good amount of calcium to build their bones. If a pregnant or lactating woman is taking good amount of calcium, this will help the baby build strong bones and will help the mother in recalcifying her bones, which helps in stronger bones. This reduces the chances of developing osteoporosis later on in life. Breastfeeding beyond 1 year appears to have long-term health benefits to the mother, as breastfeeding reduces the risk of breast cancer, ovarian cancer, endometrial cancer later on in life. Let's understand how. Ovulatory hormones helps in ovulation and endometrial lining stimulation. Increased number of ovulatory cycles in lifetime correlates with increased risk of ovarian cancer and increased risk of endometrial cancer in certain women. Breastfeeding beyond 1 year suppresses ovulatory hormones and hence prevents ovulation for the first few months, plus less stimulation of endometrial lining. So this will offer a protective effect from ovarian cancer and endometrial cancer in the mother later on in life. Women who breastfeed for total of 2 or more years during lifetime have reduced risk of breast cancer. Breastfeeding is a natural contraceptive. Frequent and exclusive breastfeeding delays the return of menstruation and helps delay pregnancy. How? Breastfeeding lady produces the hormone prolactin, which is needed for milk production. Prolactin suppresses ovulation. Therefore, a lady who is exclusively breastfeeding may not ovulate or have regular periods during the entire lactation period. This is known as lactational amenorrhea. Breastfeeding delays ovulation, delays the return of menstruation, and therefore delays pregnancy. Breastfeeding allows the mother to recuperate before she conceives again. Breastfeeding is economical. Breastfeeding is a natural way of feeding baby as compared to top feeds. For top feeds, there is a need to buy formula plus the baby bottles plus sterilization of bottles is required every time. Hence, top feeds have costs associated with it. Breast milk helps the baby to develop strong immunity. So breastfed babies are healthier, therefore less hospital visits. So their mothers have to take less time off from their work and spend less time and money on hospitalization and medicines because their babies get sick less often. Breastfeeding is convenient. Mothers can breastfeed anytime, anywhere. There is nothing to mix, measure, wash, or prepare. Moreover, breast milk is warm and at the right temperature. Thank you so much. Stay blessed.